while we're kind of waiting for people, because I like to use time wisely, y'all, and there's 17 people in here. I'll start to tell my caregiver story, and then that will kind of lead us into the presentation today. So for those of you who know me, who don't know me, I'm Elizabeth. I live in Marietta, Georgia, which is a big suburb of Atlanta, Georgia. I didn't have a specific date that I became a family caregiver. I was kind of on the mudslide of caregiving, if you will. I could kind of see it coming as an avalanche, and really there was not a whole lot to do about it. I am one of 6 kids, and we did a pretty good job, I think, of sharing the care. I have an older brother with a developmental and intellectual disability, and I had 2 parents who had chronic comorbidities. They were affectionately a cocktail of different things. We had everything from COPD, we had diabetes, edema, depression, autoimmune disease, sleep apnea, morbid obesity, mobility issues. And then toward the end, mom did have cognitive decline. I had an aunt who had supranuclear palsy and frontal temporal dementia, so I'm familiar with that as well. And my mother-in-law had lung cancer. So we had lost both of my parents and my mother-in-law. We affectionately called 2014 the spiral year for my family. My husband and I were what you call sandwiched. We were in the sandwich generation, caring for active kids and our aging parents at the same time. We both were working, we were in the peak of our careers, and we were losing our minds. We felt overwhelmed, we felt isolated, we felt like we were the only one in our friend group that was going through this caregiving journey. I'm 50 years old and no longer have either of my parents, so I do feel like we kind of hit the young side of that. During this 2014, it was a lot of missed work and going back and forth to my folks were retired in Atlanta and Amelia Island, Florida. So that was a 6-hour drive from nearest family, and it was a lot on my siblings and I. We all, we're living our lives and working. So we were trying to make sense of it all. We lost my dad that summer, and he was actually the stronger of the couple, which I think you find happens a lot in relationships, that the primary caregiver in the couple can surprisingly take a bad turn quickly. We lost dad in 2014, and then later that year, my mother-in-law. So it was a rough year for my husband and I and my kids. I then became the primary caregiver for my mom, and she moved to Atlanta, the Atlanta area. She was in 2 different assisted living communities because I worked full time, and she required a lot of care. She was kind of in this in-between place between assisted living and really could have borderline been in a skilled nursing facility. My older sister had a life change and got a divorce and wanted to take mom full time. And so we transitioned the care to my sister, Susie. And Susie had mom the last 4 years of her life. So we had many bonus years with my mom, I think, due to the care that she received. And I'm sure all of you are providing similar care to your loved ones. So that's where we are now. Is I'm an empty nester. I have 2 kids in college. I think the caregiving years made them pretty independent because they had to be, frankly. And I'm a solopreneur. I quit my job and resigned last May to pursue helping family caregivers full time. Started Happy Healthy Caregiver back in 2015 because this is my passion. Family caregivers, y'all are my people. And if I can fast track you to resources, that's what I'm going to do to help you out here. I am no longer in an active caregiving role. Really, I'm in a support role for my sister. She still has primary. Thank you, Carrie. We got our circle of friends here, Carrie. I appreciate you. We'll be talking about the app in this Worry Wart presentation. And I am a support role and a self-care cheerleader from my sister, who has primary reins from my brother, again, who has an intellectual and developmental disability. And we share the care. So my brother Tom spends the winters in the Georgia area, lives with my brother nearby, and we tag team and support for him here. And then he'll go back to Michigan when the roads are clear and there's less friction among them. So I'm delighted that y'all are here today. If you're comfortable, feel free to come on your video. Feel free to interact in the chat because I want this to be fun. We need more fun in caregiving. So I would love to get to know you a little bit here today. We are going to go ahead and get started. Hopefully you can see the screen. We're talking about worry warts, how to take action and take care of business. None of you probably worry, right? So that probably doesn't hit a chord with you, but it did for me. So we got to know each other. We tried to get to know each other. One of my favorite quotes that I love is from Irma Bombeck, and she says, "Worry is like a rocking chair. It gives you something to do, but it really gets you nowhere." And I am probably a ninja of productivity, frankly, because I want to GSD, get stuff done. So is there, what's something related to your caregiving journey that is occupying a lot of headspace for you right now? It's keeping you up at night. It's impacting your sleep. It's making you cry easily. It's just turning you into a person that you don't want to be right now. So in today's session about worry warts, we're going to help name your worry, because I think that's half of it. It's just like, what is this thing? And then address some resources to address some of the common worries that I see as a certified caregiving consultant and a former caregiver. And we're going to learn from each other. So feel free to share some resources and things in the chat box. I think I already did a pretty decent job of introducing myself, but here it is. If you do decide to jump around, definitely reach out and go to happyhealthycaregiver.com so that you can learn about the complimentary resources, the podcasts and so forth that I have. I am here to support you, particularly on how to infuse self-care into your crazy busy life. So what's your worry? I want to know. So as a certified caregiving consultant, I am trained to be a coach. And one of the things that we do is we work with these wheels, and this one in particular, we call it a worry wheel. So I want to thank Denise Brown with Carriers Academy for coming up with this idea. And, for me, it's like, I know that it took me a minute to practice mindfulness or meditation. Was something that, again, it's a practice. And it took me a minute to figure out that even though thoughts were coming into my mind, that was okay. I just needed to name it and recognize it, and then go back to breathing and be present in the moment. Well, worry is kind of the same thing. It's inevitable. It's going to happen to all of us, and we can reframe it when it creeps up. So let's address it. Let's just attack it, frankly. So if there's something in this worry wheel that jumps out at you right now as something that's a worry for you, feel free to put that in the chat box. We're going to feed our worry with action. That's the big word today. So I know when I'm happy and feeling healthy, I have more to give to other people. Peace of mind is going to come from taking action. And so today I'm going to be talking about 7 common worries that I see. And I'm not going to should all over you, SHOULD, because that's not cool. You've got plenty on your plate already, and you're doing an amazing job. I'm going to lay out the options for you like a smorgasbord, but I don't want you to feel overwhelmed by this. So I put my email earlier in the chat. Feel free to email me, and I will send you the links to all the resources that we're going to talk about today. And then you can come back to them when it makes sense for you to dive into them. So I want to encourage you to just be where you are in this moment. I call it just in time training. What do you need right now? And that's the thing that you want to take action on right now. The rest of it, that there's some solutions out there, and you can come back to those later. The good news is that there's a lot more resources coming. There's 53 million caregivers in the United States alone, and we need help. We need help. The bad news is it's not all in one place. It's frankly really freaking fragmented, and it's annoying and exhausting and overwhelming to find everything. So together we're going to unpack some of this stuff today, and I'm still learning stuff every day. And so I love it when people share what they're doing to help family caregivers. So some of these things I'm going to share with you today are free. Some of them cost some money. And many of them are for you as the caregiver, because I do feel like we get should on all the time as far as like how we can take better care of our care recipient. I know you got that covered. So a lot of it is going to be how to take better care of yourself as the family caregiver. The first worry that we're going to tackle today is emotional and physical burnout. And, it's things like if maybe you're saying, I'm so tired, I feel overwhelmed. I don't know if I can or want to keep doing this. I'm not myself anymore. And frankly, you might be feeling a little bit resentful. All of those things are normal. But a break for you is better than a breakdown. And so the first action you can do for emotional and physical caregiver burnout is to schedule regular breaks. Put it on your calendar just like you would any other wellness appointment for a family member that you love. So HFC has an amazing caregiver respite grant program that, I want to get this right, that Home Instead Senior Care, they have given away at least 300,000 hours of in-home respite care across the US and Canada. So you can apply for that on the HFC website. And again, if you want all these links, email me, I'll send them to you. I think it can handle 24 emails. Just be patient with me. They will help you, give you people through Home Instead so that you can work, you can grocery shop, you can go to your own medical appointments, and you can just take a breath for yourself. So to be eligible, you need to go on and kind of figure out if you hit all their criteria. The other, and there's some older adult communities sometimes also offer respite services. You got to pay for that one though. No Barriers Caregivers Program. So I am an ambassador for No Barriers USA's Caregivers Program, and they have these amazing caregiver respite retreats at no expense to the caregiver. Here's the good news. The application opened today. So you all can get in today or nominate someone today for to go on one of these wonderful retreats. They will push you out of your comfort zone. They'll give you a sense of adventure. And you might just have me as one of the volunteer program retreat leaders. So I love meeting and connecting with other caregivers. And I look forward to doing a couple of retreats this year. But you want to apply before March 18th. So definitely get in your application. You're never, figure out the how later. Just get your name in there. Military caregivers. This Elizabeth Doles Foundation has Hidden Heroes, respite relief for military and veteran caregivers. Amazing. Semper Fi and America's Fund offers different retreats. And then it might be that you just need to request a break through your own private care team. That's okay, to manage expectations and let your care team know, hey, I need a break every quarter. I got to get away for 3 days, or I need every Tuesday night off for XYZ, or I just want to go to church on Sunday, whatever it is. There's apps that can help. And one of those apps I'm going to talk about in a little bit. And I know they had a vendor booth, is the Circle of Family Caregiver app. So check that out. I also see someone from iAlly on here. So definitely iAlly for young caregivers to check that out. So taking action, another action that we can do to address physical burnout for us is to find those people to talk to. So there's a lot of resources here, but again, fragmented. HFC does have an online support group, and that's licensed social workers, where I'm a certified caregiving consultant. I'm a coach. I'm a family caregiver. I'm not a licensed social worker. So if you need something a little deeper, then this would be a great option for you. They meet weekly or twice a month, and they got all kinds of different groups. And I mentioned I'm a certified caregiving consultant, or a fancy name for a coach for caregivers. And there's over 200 of us. So if you need somebody and you want someone that's locally in your area, that's a great option. I recently signed up to be a caregiving.com champion for the Atlanta area. I'm already sharing a lot of Atlanta resources. So this is a way that the caregiving.com champions are just going to take over the map, and we're just going to help put all these local champions so that you can tap in. And so that's coming soon on their website, but just wanted to put a bug in your ear about that. And then I also facilitate a daughterhood circle in Atlanta. They got daughterhood circles all over, mostly for caregivers of aging parents, daughters of aging parents, but I'm never going to kick a caregiver. And I think most people aren't going to kick a caregiver out of a support group. For those of you who are asking for the links, they're yours. All you got to do is email me. So scroll back up to the chat, Elizabeth@happyhealthycaregiver.com, and I'm going to send you all of them. So I'll send you all of the links, because That's how it happens. That's how the action happens. You can also, through your condition like Alzheimer's Association, you can find support groups there. Through maybe your faith community, Administration on Aging may offer something. Or what we found, particularly during the pandemic, is the Marco Polo app, and there's a free version of that, allows you to video chat with people on your care team. And it makes it very easy to not feel like you're interrupting each other, but you can just show what's going on and show what's due, what's going on that day. All right. I don't know if this is common sense. It wasn't for me. I did not identify as being a family caregiver. I first identified with being in the sandwich generation. And so caregiver was not a thing that I even thought I was for a long time. And I don't know if you have felt that way. I'm not really a fan of changing the name though, because it's already freaking hard enough to figure out what we are. But this is how I would recommend you search for local resources in your area, is that you put the name of your state or your city and then add a keyword like caregiver support, family caregiver, caregiving tips, resources for caregivers. And then that's going to pop up. You might see something that is unexpected in your area. And then also I'd mentioned the champions and the certified caregiving consultants and all those other things. So you'll get links to that. Action. Here we go. Circle of. You got your spotlight here. Request for more hands-on help is how you can take action for physical, emotional burnout. So I spoke about scheduling breaks for you and talking to someone, but to get more help, it takes some action on your part. Nobody is a mind reader. And our caregiving journey is going to go a lot more smoother when we have communication systems in place to help coordinate everything. These are some apps, and I work closely with Circle of, so they got the main spotlight there, but I work closely with the different apps that help you coordinate the care, share the updates, request specific help. And they've also got some great resources in there. And their vendor booth, you can go and check that out later when we go back to the vendor booth if you've got specific questions for them. Be specific on the help you need. Some people, even just keep a list of things in their phone so that when someone's asking them for help, and fine's not a feeling, and then you can maybe look at something. And sometimes it doesn't even have to be caregiving help. I think that's kind of where people get stuck too, is like it could be help with mowing the lawn or grocery shopping or taking your kids to appointments. It can be anything that's going to take time and energy of something else off of your plate so that you can focus more on the tasks at hand. Bonus I've got for you is I love to divide and conquer. I've got, like I said, 5 siblings, and we all had different skills and different things. And so there's this bit.ly link, HHC Share the Care. If you're just desperate for it right now and can't wait to get the resource from me, then you can put that in. But this will give you downloads of caregiver responsibilities and family responsibilities, because just knowing that someone else is taking something off of your plate and they are the primary owner of that you don't even have to worry about it anymore. I don't own trash in my family. I don't own calling insurance companies when it's coming to stuff in our family. That's my husband's stuff. I got other things. I'm the party planner. I'm the event planner. We each of us takes turns feeding the pet and walking the dogs, but stuff like that, just dividing it up and can really help out. All right, let's move on. Worry 2. Will I make the right decisions? This keeps us up at night. A lot is being asked of us. Decision-making fatigue, it's a real thing, and second guessing what we're doing. Well, I like to say we make the best decisions with the information we have at the time. But there are some actions that we can take here. So meeting with professionals is one of them. I find one of the best professionals you can get hooked up with immediately is an elder law care attorney. These people are plugged into what's available locally in your area, and they're going to make sure that you have all the important paperwork together. And that's going to help you sleep better at night for sure. So find a great elder law attorney, spend some bucks. Sometimes some do give a complimentary initial session. Getting your arms around all the financial planner stuff is important, to meet with someone there to kind of understand that. Maybe you need a geriatric care manager. That might be helpful. And then your primary care doctor, of course, they can help you kind of get over those bumpy patches where maybe you're trying to take the car keys away or get them to adhere to their medication a little bit better, you can put some bugs in those folks' ear and they can help advocate for whatever cause is causing you a current worry right then. And then the National Hospice and Palliative Care Organization. I feel like sometimes caregivers maybe wait too long, but if you're not taking measures to extend somebody's life, then this is really important to look into, particularly because Medicare does not pay for everything, but they do pay for hospice care in most situations. And that will provide comfort and extra hands for you as the caregiver. I know when my mom was on hospice for, I think, 2 years. I mean, some people say, 6 months or less to live. However, they get reevaluated and mom could have passed many times, frankly. But this helped give my sister extra hands for personal care, for ordering supplies. She no longer had to take mom to a doctor's appointment, which was a huge ordeal. It used to take me like 4 hours out of my workday to take mom to an appointment. So definitely something to look into and just ask about. It doesn't hurt to just ask the question. And then another action you can take about making decisions is to gain clarity on their wishes. This is going to give you peace of mind. There are a couple resources here that I'm sharing on the Conversation Project and 5 Wishes to have these conversations and to, it doesn't have to be a big deal. I call it a courageous conversation. It doesn't have to be like one and done, but you can just start asking questions. Maybe, a friend of yours was in a situation and that could help you broach the topic with someone. But these are going to give you a guide and verbiage that you can use to help have those conversations. And like 5 Wishes is $5. I think the Conversation Project one, there might not be a charge for. But they do have a workbook in that one for caregivers of people with Alzheimer's or other forms of dementia, because that's its own thing, right? But the 5 Wishes, like it will legally valid in most states. And so, yeah, anyway, those are some great things to just help you there. We're moving on. Worry 3. Worry 3 is fear of doing something wrong. I mean, that's human, right? We just don't want to screw up. We don't want to fail. But, we're learning every day and we're all a work in progress. So fear of doing something wrong. We don't want to cause our loved one or anyone discomfort or hurt them unintentionally. And many of us as family caregivers were not trained formally as a social worker or in the healthcare field. I was trained as a broadcast journalist. I have nothing to do with caregiving. And so we're just figuring it out as we go. So what are some things that we can do there that we can take actions for? The first action we can take is to listen to some caregiving podcasts. So shameless plug here for my podcast, the Happy Healthy Caregiver podcast, where what makes us different is that we think the experts are real family caregivers and that you're going to share the caregiving and self-care tips that people are using from the trenches. And that's what they might have written a book. They might have done something amazing, but they got to have some caregiving experience. There's some other great podcasts. The Untangling Alzheimer's and Dementias is hosted by my friends and fellow ALS authors. It's also part of the Whole Care Network. And so they're specifically about Alzheimer's and persons with dementia. That's their sweet spot that they're focusing on. And another great podcast that Jennifer Fink puts on is Fading Memories podcast. Again, very focused on dementia, persons with dementia and Alzheimer's. And I'm sure there's some other amazing ones. So if you know more, put them in the chat. We love the chat. I love a twofer though. And so you're thinking, Elizabeth, I don't have time to listen to podcasts. And I'm going to challenge you a little bit. And I'm going to say, we got to make some time for this stuff. And we can do a twofer, I call it, where we can use our commute time wisely, put earbuds in when we're folding laundry or making dinner, take a walk outside. And so all of things are twofers, I call it, where you're getting some intellectual self-care and maybe some physical self-care at the same time. Podcasts have their own search platform. So if there's something, again, with your just-in-time training that you're struggling with today, whatever it is, you're a young caregiver, you're a spousal caregiver, you've got some certain thing, behavioral thing going on, put it in the platform of your favorite podcast platform and search for it and see what episodes are going to come up that are going to be able to help you zone in and key in on that. All right. Next up is watching video lessons. As I said, we're not experts in this stuff. So these are some things that have helped and that we've come across. One of them is Caring Boost. So they are lessons from medical professionals where they're videos of showing you how to do an enema or how to transfer someone and change bedding or whatever it is, so that you can go and see from real professionals on how to do that. There's also some lessons and things you can learn, events you can tap into from the dementia map. That's going to show you upcoming conferences and webinars and things that you can learn about. There's a great organization called Second Wind Dreams that is, in addition to giving dreams to older adults, which I think is so lovely. It's like a make-a-wish for older adults. They also offer training, and you'll see some things on there. There's some $10 training on getting through tough times with dementia, nutrition, mealtime challenges, things like that. And they also offer a virtual dementia tour. And I think that that will do is what you can get a family edition, or maybe get your workplace to pay for it and educate a whole bunch of people at the same time. Because this is probably the most expensive thing, but it's a really cool thing about how it'll teach you about the sensitivity and the challenges faced by loved ones with dementia, and how we can maybe make some adjustments to how we're doing our caregiving to better meet them where they are, frankly, and just make that an overall positive interaction. Also, I didn't put this on here, but if you all follow Teepa Snow on TikTok, she's also got some great stuff as well. Worry number 4, no time for myself. I'm losing myself. Does that feel like anybody? So I miss doing whatever it was before you were doing caregiving. Maybe you were playing a particular sport, or you were singing in the choir, or you had more time to do volunteering on something that was important to you, and you just want that freedom back. And so here's some actions that you can consider there. One is to simplify and streamline your responsibilities, whether it's online ordering of groceries, Amazon, subscribe and save, meal delivery. Don't feel bashful. HelloFresh, one of those types of things. Don't feel bashful about needing some extra help there. I really think, technology can be a great part of our care team, and that there is an important role for that. One thing I didn't know about is a concierge healthcare service. So for like mom, I mentioned it took about a half day to take her to a doctor's appointment. Well, we finally got a concierge doctor. We could text that person. He would text us back in 30 minutes or less. He allowed me to capture, a urine sample at home with the right material, so I could bring it in and have it tested versus bringing mom in, which was a lot bigger deal. So yes, shout out for all those good books. So things like that are really, really important. Caring Bridge is another great resource where you can set up, Facebook. Maybe you don't want to put all your stuff out on Facebook as far as your caregiving journey, but this can be very specific on how you can share a healthcare journey about someone. They can share photos. I was able to connect my parents together when they weren't able to physically see each other due to mom's health situation. And so it's a great little resource that's available to you. Solutions for social media. Social media, right? Love, hate kind of thing can happen here, but there's a lot of good stuff on social media. There's, like I mentioned, there's some TikTok videos, some Instagram reels, things like that we can learn tips on how to do caregiving and learn from each other, which again, we are the experts in this field. And sometimes we're just too tired to pick up the phone or leave. And so that is a way we can kind of fill our bucket that's very easy and attainable to kind of tap into, as long as you're kind of following those positive accounts. And just make sure that, whether your caregiving group is public or private when you're putting stuff out there. That's important. And maybe cast your net wide about a condition or whatever it is that you need, and then decide which ones you're going to kind of engage in, because there is a lot out there, but you hone in on a couple that are really kind of meeting you where you feel like you are at the moment. Activities just for you. That's you as the caregiver. This could be a great thing that is available to you. There's yoga, online yoga for caregivers. They offer yoga classes. There's online Bible studies for caregivers through Ladies Who Love Christ. And then there's stuff like what I'm doing with Jen Chan of Senior Shower Project. We're doing a combo virtual Happy Healthy Caregiver virtual cafe and caregiver dance party on St. Patrick's Day. And you can get a link to that on my events page. But if it's hard to get away from the house, one thing we've gotten really comfortable with is doing virtual interactions. And so there's some really good options out there for you to just feel less isolated, frankly. Worry number 5. Worry number 5 is I'm concerned about my care recipients' health and happiness. We're good people. We want everybody to be happy and healthy. And, this is different than just feeling like you're going to make a mistake or you need some kind of training. You're worried about their isolation and their boredom. Are they taking their meds? Are you concerned about a fall? Things like that. So this is, again, where technology can really help plug in of how we're doing medication management. There's some great options out there. One company I work with is Hero Health that has a medication dispenser. Life alerts, where and they've made them really cute now. Where again, developed by a caregiver, Telaware, I think it is, where she's got a life alert through a beautiful necklace, or it could be through a watch, things like that. It doesn't have to be that old bulky looking button. Look into your telehealth options, perhaps at your workplace or your loved one's workplace. Online shopping for caregivers. We can do that with Carewell and some other places where we have exclusive shops where we can call somebody and ask questions about supplies. Virtual health assistants and smartphone reminders. It took me a minute to catch on to that, but sometimes your hands are full. It's so nice to just say, hey, Siri, she's probably listening now, and remind you to do something at some time in the future is a great option. The companionship for our loved ones is a thing. And I know it was a thing for us for sure when mom was bedridden for about 2 years of her life. And we were like her source of entertainment, her family and the professional caregivers coming in. There are some options that you can look into. One is Clear Day at Home. They were, prior to the pandemic, they had adult day programs and they figured out how to do stuff virtually. So to keep people engaged, particularly with persons with dementia and caregivers of people with dementia. This is for you. This is a paid service, but there's some good content in there that can help keep people engaged. Memory Cafe directory can be another option where you can activities with persons with dementia, conversation, music, dancing, crafts, reminiscing is an important thing that they do there. And looking back, I just was frustrated too sometimes with people showing up at the same time, like when my mom was in assisted living in particular, and I would be like visiting my mom, and all of a sudden my brother would come, and I'd be like, oh man, why didn't we coordinate this? So even if it's just a phone call, a FaceTime phone call, things like that, like maybe people can have certain nights of the week or certain days so you can spread out the love a little bit. And then you can know too that, like, for me, it was Wednesdays was my night with mom. I did a little picnic in her room. I'd get a couple things off of her to-do list. She always had a big to-do list for me. And then I would make sure, this was a tip I got from one of my first caregiving support groups. I made sure we did something fun, whether it was coloring, watching Frankie and Grace, or playing Skip-Bo. Those were some of the things that we enjoyed doing. But I think it was important to kind of reconnect with that mother-daughter relationship. Here's my mama. So this was something that we did to entertain, to keep her in, with subscription boxes. And I've tried various ones over the years with her. There's ones that are geared towards seniors. There's ones that have healthy snacks in them. That was a great one because eventually when she was bedridden, she didn't eat a lot of stuff. But healthy snacks was fun, and whatever one she didn't like, she gave it, put in a basket for the professional caregivers. But it was a way for me to connect with her long distance and say, Mom, I'm thinking about you. Sometimes we do the unboxing together over FaceTime. Maybe you can send even a subscription box to your primary caregiver if you're the long distance caregiver. But this is a way to kind of avoid boredom, and she got a lot of joy out of those things. Audiobooks through Libby is a good thing. All you need is a library card for that one. So eventually Mom's eyesight went, and so that was something that she could listen to very easily. She loved a good romance novel, my mama. And then FaceTiming with friends and family is also important. Worry 6. Will there be enough money? I'm thinking, will there be enough time to get through these worries? But will there be enough money? It's so hard here on this one, y'all. It's a tough one. I wish there were better resources here. I really do. And if y'all have ideas, put them in the chat. But many of us have to, have the great resignation happening where many of us chose to leave or change careers or minimized our hours to help take care of caregivers, or take our care for our loved ones. But we still got to make a living, and we got to plan for our retirement and pay our own health first and wealth first. So organizing finances and passwords. I'm going to give you the tips I know about. I'm still learning. As I learn more, I'll share more. One of them here, this is a new partner of mine, is the Like Paper app. It allows you to put in all your important documents so you can feel safe and secure that all your power of attorney, all your insurance cards, vaccination cards, blah, 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 medication list, you can put that all in Like Paper. And this is a good source for your health and your financial documents, frankly. Sharing passwords. It's hard enough to keep with my own passwords. And then my mom would be calling to ask me about her passwords and how to get into her things. And oh my. And I needed to share them with siblings and other people on the care team. So we had a password vault. We use Keeper. There are other ones out there. That one works for us. We still use it today. My husband and I and my kids, we can share things in there. And it's a good life skill to kind of teach the kids that they need to kind of keep track of that stuff. Automatic bill pay, bill alerts, bank alerts. So much fraud is happening. I hear about this all the time. I've had it in my family with my loved ones, with my brother, being taken advantage of on Facebook, and my uncle with, fake IRS calls, so many different things. And so it's important to kind of have that bird's eye view on the holistic picture of the finances. And Careful is a tool I've learned about that could potentially help you with that. Wouldn't it be amazing if you get paid for the care that you're already giving? What a relief that would be for you as a financial self-care. I wish more states were doing this. I think it's catching on. Particularly, I think the pandemic has shed light on this. But there are, and I got this from this Washington Post source on caregiver.org, but Family Caregiver Alliance state by state listing, you can look up your state and you can see under compensation if there's an option for you in your state. And this might be outdated, frankly. So hopefully there's more that have been added there. Another option would be to private pay. If there is, your loved ones have the money that you to be paid for the work that you're in the hours, an hourly rate, just like you would pay if you were, doing it, hiring people in and externally. Sometimes too, states have a respite program where you can set up somebody to be paid to offer you respite. That's another option. And then recommend the respite grant from HFC. Thank you for reminding that. And Home Instead, that's gonna give you some dollars so that you can get some hours from Home Instead. So you can apply from that on the HFC. And great, South Carolina, yay! Keep. That's so important, y'all. We need to. And I know there's some stuff that's being pushed out, but that's where we are today. Saving money. I mean, we can't make the money. We can at least try to get creative in ways to save money. I've learned about Good RX recently, which is a way that you can save money potentially on your prescriptions. You can also save money by buying in bulk. We certainly could have had stock and Depend and Poise pads and things like that. But buying in bulk those were things that my mom needed all the time. And it was so stressful if we ran out of those. It would make or break a day, frankly. And then another thing is, so many of us are shopping online. Good to get money back. And I think there's Honey and Rakuten is what I use. Used to be called Ebates, but all I do is shop online. Not only does it give me the money back, but it also applies the coupon codes automatically. Who's got time to figure all that out? Rakuten does it for us. So that's amazing. Last worry here is the loss of a loved one. And it's kind of inevitable, frankly. It's going to happen. But we worry about it because we want to make sure that we know everything about them. Do we know the family history? What objects were meaningful to them? What was our loved one's favorite color is? And like sometimes these things will haunt you afterward. You're like, gosh darn it, why didn't I ask? I'm lucky I got some siblings that have better memory than me. I can ask some of them. But this is how we can address this worry by capturing the stories, the amazing stories and the amazing moments of our loved ones. So record the conversations. Maybe it's not even a whole conversation. I love Care Partner Patty, I think her TikTok, where how wonderful is that going to be for her legacy of just like capturing these TikTok videos with she and her mama as they do all their arts and crafts. She's a champion, by the way, a caregiving.com champion. But to record the conversations, Mom, I have this, I have the podcast. I can go back and listen to my mom there. It was a wonderful thing that we did. But my sister just used to turn on the voice memo and just ask her questions about different stuff. And we would capture those stories that way. We got some of her favorite prayers. What are some things you want our kids to know as far as the mantras and the missions, and depending upon where your loved one is in their cognitive journey, it might be a little garbled, but it's going to be good. And just to hear the voice, even their voice is going to be amazing. So record the conversations. There's some services like MemoryWell that can help you capture those stories for you. Maybe you don't want another thing on your list, or this isn't just a strength for you. There are other people that can help you interview your loved one and start to capture those things. Just even sharing pictures and putting them out, that will help spark and have conversations in different things. And even I've been kind of saying another way to use my journal, the Just For You journal, is to take one of the prompts in there and ask your loved one that. So sometimes it's hard to Okay, so these are the resources for Happy Healthy Caregiver. The last thing there, I had a picture of Little Free Library. That was a way that we honored my mom. And I would just love to stay connected with you all. Happy Healthy Caregiver does offer lots of resources through the journal, through my podcast. We have a self-care support group for caregivers that you can tap into. And would just love to stay connected, because that we're really, in No Barriers, we call that a rope team. And by the way, that's the first action, is sign up for the Caregiver Respite Retreat when you leave this. But I hope that this was beneficial for you. I want you to at least just think about the one big worry that you have, and what's one thing that you can do to take action on that. And then another thing would just be, if you don't already have a local support or a way to just someone to talk to, definitely tap into that, because that's going to help you with tomorrow's worry, which is just going to happen, whether we like it or not, as we said. So not a lot of time for questions. Again, if you want the resources that I shared today in this presentation, I'm going to send you a 2-page list of all the links. You just have to email me, Elizabeth@happyhealthycaregiver.com. I would love it if you join the email list. You can either let me know in that email that you want to be on the list, or you can sign up for the Happy Healthy Caregiver email list on the website. But that's going to help you just stay informed about future events and future things that are going on, articles, and ways that maybe we can help you with those future worries too. So delighted that you all joined me today. Thank you so much. Let's go back into the main room now and enjoy the rest of CareCon. Happy National Caregivers Day to all of you.